In wheat, it is the lysine which is limiting. Okay, doc. You need to give me one confident answer. One confident answer. Small lipophilic molecules which bind strongly with the extravascular proteins. You know some pharmacokinetic parameters, no? Half-life, volume of distribution, bioavailability. Which pharmacokinetic parameter? Will it be high or low? If the molecule is small, lipophilic, that binds strongly to the extravascular proteins, such a drug if you give, which probably I should tell at least some pharmacokinetic parameter and ask you will it be high or lower. But you are all exam going. If you show half question, you can be able to imagine what is the remaining half. Yes. High what? Shankar says low VD, volume of distribution. Madhuri says high VD. Shankar rephrased it as long T half. Anantapur says low VD. Madhavi says high VD. What is volume of distribution? Amount of the drug in the body, total body divided by plasma drug concentration. Suppose if the drug is able to distribute into the tissues because it is lipophilic, it is small and it is able to bind with the extravascular proteins in the tissues very strongly, it will have a high VD because it will distribute more into the tissues. But if it is a large molecule, not a lipophilic but a hydrophilic one, not ready to bind, then it is more likely to have low VD. So high VD. Who answered it correctly? High VD. Sunain, Warangal, and Dr. Madhuri, you get all a big clap about VD. Once more, let me tell you. VD, clearance, T half, first order, zero order, loading volume, maintenance volume, maintenance dose, loading dose, pharmacokinetics, 10 pages in CAD-Zung or any Zung. You have to read, doctor. One question definitely comes, that will be the seat limiting step, like a rate limiting step. So today only you are going to review that. What is a new family? All nuclear families less than 10 years duration. They call 7 year each, no? It is 10 year each to define it as a new family. Now, Carter thermometer, cooling power of air. Composting is not safe disposal, but it will help in the building of the fertilizer in the ground. So what will you do with all your study material after the entrance is over? Use it like a composting so that at least ground become well, farmers can grow. With all your entrance books, dump it in soil and go for post graduation with a fresh mind. Then another option is also there. If you don't get seat, you can incinerate all study material. You can burn it. But incineration is used selectively for different purposes. Okay, doc. Now, diethyl toluene, it's a repellent. All purpose repellent it is called. So, you don't want any of your classmates come close to you while you are preparing, apply little diethyl toluene and go to reading room. It is an all purpose repellent. Aedes is the tiger mosquito with the stripes on it. This you have to give me one confident answer. Whoever answers it shall be called as correct answer. Renal and liver disease में किसी ड्रग को लिए तो उनका मेंटेनेंस डोज को क्या होगा, लोडिंग डोज को क्या होगा, Will it increase? Will it decrease? Will it be unchanged? I need two answers. For maintenance dose, one for loading dose. Let me check. Who will give the correct answer? Loading dose increases, say Shravani from GMC. What is maintenance dose? What will happen to maintenance dose? Yes, doc. Maintenance dose decreases, loading dose same, says Sumati. Anjum says maintenance decrease and loading increase. Shankar says excellent. I want to see somebody say unchanged. One of these two will be unchanged. Shankar says maintenance unchanged, loading dose is increased. You also said the same? Excellent, doctor. Maintenance dose is decreased and loading dose is unchanged. That is true in renal and liver disease. Whoever answered it, Shankar almost reached, but idhar udhar dal diya. Loading dose decrease bol rahe hain, but loading dose is unchanged. Maintenance dose is decreased in renal or liver disease. Frequency of dosing is not affected by the time to steady state, but is affected by T half. So T half affects the frequency of dosing. So what is loading dose? It is the volume of distribution decides loading dose. Drug clearance decides maintenance dose. These are the concepts which you have to be very sure. Why is it like that? This session is too short because you are all exam going, hoping that you know this concept. We discussed it many times in our regular classes. Now, coming to the cotton dust inhalation. Bicyanosis typically is cotton dust. PQLI does not include paise ki baat of per capita income. Randomized control trial may groups are representative of population, everything is true. But option D may, what is meant by single blind? Single blind means the participant is not aware whether he belongs to study group or control group. The entrance going aspirant doesn't know whether he belongs to NEETPG or state PG entrance. He is single blind. What is double blind? Neither the examiner knows nor the entrance going aspirant knows whether NEETPG is going to be there or not. What is meant by triple blind? Neither Supreme Court knows, neither the student knows nor the examiner knows. Is triple blind. Okay, doc. Vitamin A prophylaxis is specific protection, as all of you know very well. For the TB-like drug disease, early diagnosis and treatment. Diagnostic power of the test to correctly exclude is called negative predictive accuracy. Amoebiasis ka 2 to 4 weeks is the incubation period. We use tetracycline especially for cholera as a chemoprophylactic agent. Filariasis has got 8 to 16 months as incubation. Quarantine period for yellow fever is 6 days. French fever is quintana. After running through single liners comes the actual question. You don't know, doctor? If you want to, for which intoxication, you want to give ammonium chloride. Ammonium chloride is acid. Generally what do we give? Alkalinization. Everybody will remember which drugs alkalinization we use. For which case we use acidification. Who will give me correct answer? Correct answer. Yes. Your streaming speed should be good, doctor. 1 Mbps line comes for how much? 1000 rupees a month. If an online class should be enjoyed means from home you have that privilege. You need to have an internet guy who provides a consistent 1 Mbps supply. Otherwise, technology is very affordable technology. Okay. What is your answer? For which drug intoxication we use ammonium chloride and acidify the urine? Nobody is giving the correct answer. What is your answer? Barbiturate poisoning, doctor, we use alkalinization. Like that, for which? Generally you will make guesses, no? Where are the guesses? For which, I think question is not clear. Which drug overdosage we use to treat ammonium chloride? Do we administer ammonium? That's right, doctor. I am waiting for that only. Sumati correctly answered. Amphetamine. So you know now, weak acids, weak bases. Drugs are classified into. For weak bases, especially amphetamines, they become trapped if you give acidic environment by giving ammonium chloride administration. Whereas phenobarbital, methotrexate, aspirin, they are all weak acids. Hence you create an alkaline environment by giving bicarbonate and treat them. Because if you give alkaline environment, a weak acid become ionized. If it is ionized, it is not reabsorbed. It remains in urine and lost. So amphetamine is the answer. Everybody, I really doubt such a simple question of amphetamine only Sumati only could answer. Huh? No problem. Probably question framing was wording is not very clear. Okay, anyway. Out of all, rifampicin is Raja, most powerful rapidly bactericidal drug in Mycobacterium leprae is what need to be remembered. Now coming to the JVP, what is A wave? Atrial contraction. It occurs towards the end of the ventricular diastole, last part of the ventricular diastole. During that time, if the ventricle is not compliant, what will happen? Atrium has to use more force to push the blood, and that will create S4. So fourth heart sound and A wave will both coincide with each other. At the end of the A wave, what is over? Diastole of the ventricle is over, AV valves closed down and S1 is heard. S1 is heard at the end of the A wave, and A wave coincides with the fourth heart sound, which is the late diastolic sound, is what need to be fundamentally remembered. Where do you find large cannon A waves, doctor? Complete heart block, VT, paroxysmal nodal tachycardia, etc. Coming to atrial flutter. Typically, the atrial rate is classically 300 BPM. But a flutter will create some amount of AV nodal conduction block, and the ventricular rate will be half, 2:1 or 3:1, 1/3 of the atrial rate, and that will be either 100 or 150. So atrial rate 230 is not possible in atrial flutter. Atrial rate will be 300, ventricular rate will be either 100 or 150. So this is the typical values which need to be remembered with regard to flutter.